the other options for the younger guys who may have a little bit lower levels, but are still apprehensive is there's another way that we treat men, that still are producing testosterone enough on their own, but need to get a little boost. And that's through enclomiphene and Clomid, which is actually a natural way to boost your body's own production of it.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am excited to talk about some very hot topics, and we have a husband and wife team. We have Katy and Josh Whalen, and they started Blokes and Joy based off their own personal health journey, and they fight the sick care system and treat with diagnostic labs, hormone balancing, and peptide therapy. They are actually licensed to treat in all 50 states and do telemedicine. So Katy and Josh, thank you so much for joining us here today.
Hey, thank you for having us.
Yeah, thank you.
All right, awesome. Well, yeah, let's start with a brief background of how did you kind of get interested and land where you are today?
Yeah, I'll let Josh start. It was really me threatening him with divorce, so I'll let him tell the story as to why.
Yeah, it's, coming off a career in healthcare of almost 15 years, I was just not myself. And Katy was finally had it. And she said, listen, I'm going to divorce you if you don't change. And what we ended up finding out is that I had really awful hormones, and I went through the standard channels of healthcare that most people go through. And I was told to basically accept this as my new norm. And being an entrepreneur in healthcare so long, I then found like that was the whole, like there was a massive miss when it came to preventative and proactive care. And what we have found through our personal journey and then running these companies is hormones to us are the most important messenger cells, most important chemical messengers in the body, whether it's hunger, whether it's sex, whether it's mind, anxiety, depression, they're all tied to hormones, whether it's insulin, So for us, it just was a natural fit from an entrepreneurial standpoint. And it just really started out of our personal struggles with the system and just, losing sight of our health.
Amazing. And so I assume you went on hormone therapy and was a game changer for you personally?
Yeah. So my experience was I went to a lot of primary care and internal med docs. And in many cases, I had to plead for getting my testosterone levels even ran, let alone interpreted the right way. And, I was basically sent home packing and told there was nothing that we really should do or address. And just by sheer luck, I was able to find somebody that specialized in hormone optimization. And that was an eye-opening conversation. It was not like, it was very, very stern about where my levels were and that they were the equivalent of a man who was in his 80s and an unhealthy man at that. I was floating between the high hundreds to low 200s in terms of my testosterone levels. So it all made sense. And, once that light bulb kind of turned on is really when it became a game changer for me mentally, physically, our relationship, me as a father, me as an entrepreneur, a businessman. And that was really like that onset of like, wow, we need to do something to change this.
Yeah. I mean, it's funny because a lot of people talk about biohacking and, stuff like that. And I mean, I think from what I've heard, hormone therapy, is like the ultimate biohack. I mean, everyone I know who's gone on, and we could talk about, potential, people being afraid maybe of TRT, testosterone replacement therapy. But everyone I know who's gone on it, they're like, changed my life. Like my motivation went up, my how I feel, more energy, just like have this vigor back in my life. So it's pretty remarkable. I mean, I don't know that there's been anything that has created such a huge impact in so many people especially over the past decade as it's kind of grown and kind of come into the mainstream public now. I assume you're seeing kind of similar results with a lot of your clients.
Yeah, I think our biggest antagonist is misinformed and miseducated, and that is not only happening from just the general public, but even other physicians or providers that are just very unaware of the value and importance of testosterone, because we don't look at it as a performance enhancing drug, a steroid. We look at it as a human hormone, something that both men and women need, and to live a very full and thriving life, it's very important to have it at an optimal level.
Yeah. Yeah, absolutely. And on the female side as well, right? I mean, I've heard of many stories of women, particularly around menopause and then having their hormones be off and then being able to have incredible results as well. Katy, are you seeing that as well?
Yeah, actually, and that's why we started Joy. We started Blokes first based on him, and I was not paying attention. I was busy having my babies at that time. But then after I had my babies, I was in my low 40s, and then it was like, what is going on with me? And that's exactly when I got help, actually through the men's side. And then after I got that help, I was like, what are we doing not serving the ladies? And it was a no-brainer for me that women out there needed way more help. And so that's why we started Joy.
Nice. And are you seeing it? Go ahead.
Oh, sorry. I was just going to say, like, it's a healthcare problem in terms of just the misunderstanding of something so valuable. But then, it's also the mechanisms and where these messages are being delivered. For example, Katy is obviously at that perimenopause age, and usually the gatekeepers to a lot of this information and knowledge is the OBGYN that they see on a very regular basis. And then you start to peel the onion back and you realize that 1 in 5 OBGYNs are even trained in perimenopause or menopause, let alone something around testosterone from an optimization standpoint. So it's an uphill battle when we educate, but once we do, whether it's a just a member of the community or a physician, it's pretty earth shattering.
Yeah. For men, it's pretty straightforward most of the time, right? Low testosterone. For women, is it a little bit more? Is it mainly just around menopause, or is it like a little more complicated? Are there other instances where you're seeing kind of women need hormone therapy?
I think women in general are more complicated than men. So yes, and really for us, menopause, is usually around the average age is 50, but really it's the 10 years before when our hormones start to go wacky that we start to see real issues, and we start to go like, something doesn't feel right. I haven't changed anything in my lifestyle, but things are feeling off. Maybe it's I'm gaining weight around my middle, or I'm not sleeping at night, or my anxiety is higher than it should be. And so that's really the 10 years before. Even sometimes, mid to late 30s, we see women start to feel these kind of things. And that's usually starts with our progesterone declining. So for men, yes, it's testosterone, but for women, it's estrogen, progesterone, and testosterone. So yes, a little more complicated, but once you nail the right balance, it's really night and day.
Yeah, that's what I've heard as well. And so for the people listening then, I don't know that there's been a lot of education that I've seen personally around peptides, right? And I know that's something you're both doing as well. What's kind of the difference between kind of the difference between hormone therapy and peptides? When would someone kind of maybe go the peptide route? And and kind of what are you seeing? I mean, there's so many different peptides, right, for so many different use cases.
Yeah, you kind of nailed it in that last sentence. There's so many different use cases, and I give the analogy like for hormones that if I'm a body of water, it just raises the whole boat, and it does a lot of things really well. And then if I'm a peptide, I'm focusing on certain portions of the boat to raise. And because they're so specific at what they're trying to achieve. To level set, we have hormones in our body. It's part of our system, just like peptides. They're flowing through our body naturally. We have thousands of them. We have many hormones in our body that all serve a very vital role to our everyday functioning. And, people don't realize insulin is a peptide, but it's also a hormone when it's endogenously, when it's in your body. And it's a very, very important peptide that you can't live without, So, to us, they kind of go hand in hand. And most of our people have started to feel some type of effects of aging. And we can get very specific. And a lot of that determines that a lot of that is based off of labs, their biomarkers. A lot of it is based off of needs, where they're at in their life, and then goals. What are they feeling and how do we address those symptoms? But, peptides solve a lot of different issues, whether it's hair, whether it's sex, whether it's growth hormone, muscle toning, weight. Obviously, weight is a big thing with GLP-1 medications. And then hormones, to me, I just feel like everybody should have optimal hormones regardless of where you're at in your life.
Yeah. Yeah. You got me hooked as soon as you said the peptide for hair, man. I'm trying to keep my hair. What's the peptide for hair?
Well, the first peptide is genetics. And then to get ahead of it, just try to stay ahead of it before you start seeing anything start to happen, because it's a lot easier to keep when you have it.
Yeah, for sure. But there are peptides specifically for that as well?
Yeah.
I haven't heard of that.
Yeah. We've got a great one called GHK copper, which is a really great tissue regenerating, really great for both skin and hair, but it really helps bring blood there and helps keep and grow more hair. So yeah, that's a really good one that we like to use.
Nice. And is that topical or is that an injection?
It's topical. It comes in creams and foams and that kind of stuff, sprays.
Interesting.
It's great. It's especially compared to a finasteride, that is very inexpensive. But it's a great natural approach to maintaining and growing your hair back.
Yeah. I've always been afraid to go the finasteride, minoxidil route, just because I know it's a very small percentage, but there is that whatever it was, couple percent, 3% of people who have long term issues with it, and so I was always kind of skeptical, didn't want to go that route. This sounds like a great alternative.
Yeah, I think it is. I think the reason why you see so much of the finasterides in the world is because it's inexpensive. It's very cheap and it's effective. But there are some serious warnings to those drugs, especially for men with, erectile dysfunction. I mean, there's even studies that show that it may shrink the size of your penis, so you want to be cognizant of that stuff. It's rare, but things can happen.
Yeah. And so I know there's most peptides are injections, right? I know there was like the BPC 157, I believe, is a really popular one. And I know that I did see that that there were some capsules available like for that one. What are your thoughts on, are peptides best done as injections?
Yeah, it pretty much depends on the specific one. And like BPC, it's done both ways. We see that one as, depending on the use. So if there's like a surgery or a wound or a tissue repair, then injection at the site is probably your best bet. But then if it's like a gut health overall inflammation issue, then a capsule we find is better for that.
What we typically say is being consistent and ease of use is always of value. So, it's like getting on any diet or any type of weight plan. The more consistent you are, the more results you're going to see. So some is better than others. And it really, like, you'll hear us say this a lot throughout this conversation. A lot of it depends on the user, and a lot of it depends on the journey and the goals and what we're trying to achieve. We try to make it as user-friendly as possible, regardless of the circumstances, and we try to address it at the root cause.
Yeah. I mean, someone like me, even, kind of one of the reasons why I haven't tried peptides myself, I'm like, I have to inject myself every day. I've never injected myself with anything. Like, seems kind of, like it's a little, scary if you've never done it before. But like you said, there are other options as well, right? Some of them are oral. Testosterone, you can use the cream, I believe, right? If you're really not able to do injections. So yeah, it's great that you're working with people to use it with the way that's comfortable for them.
Yeah. And I think I think the most important piece is accepting like where you're at in life, and that you have to make change. And, let the providers and the pharmacies figure out how we can compound it the best way. I mean, like you mentioned testosterone, we can do it in creams, we can do it in pills or capsules, troches. You can do it in injections, you can do it in pellets, you can do it in patches. There's so many ways to do this. So your hurdle should never be about the fear of doing something, because we've gotten so creative within these pharmacies that we make it very user friendly.
Interesting. I never heard of pills for testosterone. That's a thing now?
Well, it's technically a troche. So I call it that
What does
just
that mean?
for frame of reference. It looks like a pill. It looks like a little tablet that dissolves under your tongue. You put it in the side of your cheek, and it just takes about 1 to 3 minutes to dissolve. Take it on a daily basis. Guys do really well with it. We tend to with certain things think that the gold standard is injections, but like I said, sometimes some is better than none.
Yeah. Yeah. Interesting. That's really cool. Very cool. So let's talk about also one more thing, and then we'll probably circle back through all of these. But weight loss right now, right, is obviously it's always been a big hot topic. And I know you're all, you're kind of taking advantage of some of these newer weight loss things, which again have been a little bit controversial, with regards to these, weight loss injections, these new drugs that are now out. But I know for people who are really overweight, right? I think the controversial part is like, people who are maybe 10 pounds overweight, just trying to get a summer body, and then they start injecting themselves with these weight loss things. And some people say you can lose muscle and things of that nature. But for someone who's 100 pounds overweight or more, losing a little muscle is not their concern, right? Losing weight can be a real game changer. So I've kind of like I'm no expert on this, but from what I've kind of been hearing and about it, it seems to me that, for people who are overweight, substantially overweight, I guess, clinically obese or whatever we would call it, these could be a real game changer.
Yeah. Yeah. I think that they are. I mean, obviously we know all the diseases that come from obesity, and this is, really helping people finally who have tried everything, actually lose weight, because it works on a little bit different of a mechanism. So it doesn't just, the other kind of controversy is sometimes I think people think it just makes you not want to eat or makes you nauseous or something like that. But really what it does is it works on your GLP-1 receptors, which we have all over the body. So it pings those receptors and improves your insulin sensitivity. So it actually will help you use your food as energy versus storing that. So it'll help with your metabolic health. And then it also does ping receptors in our brains to kind of change those cravings and help you make better choices. I like to call it food freedom. A lot of people get obsessed with what you're eating and the cravings and that kind of thing. So it really helps change that behavior. I took it to lose weight after my pregnancies, along with being healthy. It's you have to do all of the lifestyle things. So I personally know what it was like, and it really did help me make those better choices. But you also made a really great point about losing muscle. And so that's why we really encourage people and coach people to really focus on protein, and also focus on, not only moving their body, but lifting weights and doing things like that to maintain that muscle, because muscle is important for sure.
Yeah, I think that's one of the most important pieces of advice there. When using these drugs is making sure you're taking in adequate protein and lifting weights. To make sure you're not losing the muscle mass. Yeah, for sure.
Yeah, no, I'll tell you, like Katy mentioned this. I think one of the most important things for anybody to understand is it's a silver bullet, but it's not the magic bullet. Like, we have patients come to us all the time just thinking that all of a sudden it's just going to come off, and you still have to do the diligence. It's just like testosterone, for example. We're not polarizing testosterone, but all of a sudden your body, your mindset gets a little bit of an advantage to get into the gym more, to work out more, to be more positive, to drive, that's what I think this medication is finally doing for our population. And keep in mind, over 70% of our country is either obese or overweight. And if you want to go down the rabbit hole, we can talk about why that's the case, but there's a whole big rabbit hole to that. And I think, I look at it, for the first time in history, we actually have a drug that works for people who have weight issues and obese. And there's so many different uses that I think you're going to see evolve over this, whether it's Alzheimer's, whether it's, lowering the risk of heart attacks. I think it's going to be a blockbuster drug in many different ways outside of just diabetes and weight loss.
Very interesting. Very interesting. And Katy, when you kind of, I guess, did you come off it then after you lost a certain amount of weight? Did you come off it? And then, because that's another concern that I think a lot of people have is like, oh, when they come off it, they're just going to gain it back. And then they're going to gain it back with less muscle or something like that. What would you say to that kind of argument?
Yeah, I mean, the point is not to be on it forever, for sure. Some people may need that. Personally, what I do now is actually a microdose. And this is not like, we don't have a protocol for this, but this is just me personally, because I see kind of the other studies of benefits from this. And I really do enjoy the food freedom, which I call it. So I do a much smaller dose, every other week now. And I can just kind of, again, just feel like my body is working a little bit better for me. So that's my personal journey. But we definitely don't recommend, that you need to be on it forever.
So just to give you a little background, like there's in order for insurance to cover this, there's basically two criteria that a patient should meet. And one is their BMI should be 29 or higher, which, to be honest, the BMI scale is flawed in itself. I would be that, and I lift weights, and then it's type 2 diabetes. And you mentioned, people who are maybe 10 or 20 pounds overweight taking it, they may be doing this out of their own pocket or own expenses, but I still think there's a lot of benefits to people managing their caloric intake, whether when it comes to longevity and vitality and just overall health. And, these drugs are really good at lowering blood pressure, BMI. A lot of good things before you're actually at that point of like, man, I really need intervention. I think the controversial piece is it taken away from those who really need it? And, the reality is the manufacturers just didn't make enough.
Yeah. Yeah. They'll make more. There's demand. They'll make more.
They're making more.
They're fine.
Yeah. Yeah. Interesting. Great. Well, circling back, because again, for myself also, and I'm sure many people listening, right? I think let's specifically with testosterone replacement therapy, which is a big one. It's such a game changer for so many people. But there's a lot of people who are like, and even myself, I found myself having this conversation recently because my levels are decent. And so I had a conversation with someone recently, like, yeah, let's try to hold off, at least till we're 50 and then, and maybe then we'll do it or something like that. Because I don't know, I guess there's some sort of stigma, I think, still about long-term effects or, can people be on testosterone for 40 years and not have any side effects. I think there's rumors, I don't know how substantiated they are about, heart or, cardiovascular kind of issues, I think is the main kind of rumor that's out there that I haven't seen any studies or anything like that back up. But what do you say to kind of clients that come to you with these concerns?
Well, I think you're honest. There is no clinical study that shows a man or a woman taking this for 40 years. And I think the important thing about these therapies is you address the symptom and the root cause. And, there's two ways to look at it. You could be the biohacker who just wants to feel amazing and different. But if you're steady and you're staying the course and you're achieving your goals, then there's probably not a real reason to optimize in that sense. But everything right now clinically points to a very, very high safety profile, especially when done under medical supervision and especially when incorporating labs. If anything, I would tell people, quit buying it from Joey Smith in the back of the weight room who's selling it out of his car. Do it under medical supervision, incorporate labs on a relatively extensive basis, especially as you're just getting on, because there's things that you can get ahead really quickly and really easily and mitigate before it becomes an actual issue. I lean on the side that these are phenomenal options for longevity and health span. And clinically, there is data to prove to that. And recently, they just did a study about how this actually is good for heart health.
Interesting. What was that?
Sorry, I just want to say there's one there. I think you should also mention the other options for the younger guys who may have a little bit lower levels, but are still apprehensive is there's another way that we treat men, that still are producing testosterone enough on their own, but need to get a little boost. And that's through enclomiphene and Clomid, which is actually a natural way to boost your body's own production of it. So that is something for the younger guy that we like to lean on if they're in that range to hold off on actually replacing it.
Yeah, I think to dive in that a little bit deeper is we're seeing really an epidemic of lower testosterone levels. And we say this every day, you're not the man your grandfather was. And, we can easily predict that there's a 30% decrease over the last 30 years. The question of why is a completely different subject, but we're seeing this younger and younger, and there's ways to do it. And I think the bigger concerns about testosterone from an exogenous standpoint is it shuts down the body's natural production. It shrinks the testes. The reality is most gals stay on it because it's so effective and because they're achieving a feeling that they didn't have when they had hypogonadism or low T. So it's usually a choice. The reality is when you get off of these therapies, such as testosterone in exogenous form, your body does recreate that. It does come back. We just don't have any clinical data that tells us 10, 20, 30, 40 years, but we feel pretty good about where we're at.
Yeah. Yeah. And also, I mean, the people who I know who are in their 60s and 70s who are on it, they look amazing. They feel amazing. They're stronger than people 30 years younger than them in many cases. And so that quality of life, there's something to be said about that for sure.
Totally.
Yeah.
I think, for me, I want to live the best version of myself today, tomorrow, and, 30, 40 years. And, whatever I can do to do that, especially being a literal candidate of low T. I mean, you saw it almost, cause our marriage to go to shambles. And I would much rather be in this position to win than that position.
Yeah. Yeah, absolutely. Absolutely. And then, so with peptides then, what are the most common ones that you're seeing in your, that the clients are using for yours? I know there's so many in different use cases. What are the kind of like the most popular ones right now?
The most popular one is semaglutide and tirzepatide, which is part of the GLP-1 agonist family. And I think there's a reason for that popularity. One, because we have a country that is another epidemic in itself is weight. But I think too, because they're very effective. And for the first time in many years, we have an FDA approved drug that has foregone many, many clinical trials with many patients. And the results are starting to speak for themselves. That said, there's so many other peptides that we use. I mean, growth hormone peptides are phenomenal, especially with the aging population.
It's one of my favorites for sure.
Yeah. I mean, women love it because it's so amazing for skin elasticity. And a lot of them have a natural, appetite suppressant and muscle toning. Guys love it because you feel it. You feel stronger. Your recovery is better. And it's one that is very effective.
Often
so that's different than the actual growth hormone. This is a peptide that will stimulate your body to produce more growth hormone.
Exactly.
Correct. Very important difference there for sure. Yeah. And this one also comes in a troche as well, or an injection. So I do the troche version myself because, again, I think that's a little bit easier. And I just take it right before bedtime because that is usually, when you're recovering and sleeping is when your body is producing most of your growth hormone. So that's when it boosts that production. Yep,
absolutely. So I guess the first step to all this stuff is to get a whole panel done, right? And see kind of where you're deficient, where do you need, is it testosterone? Is it something else? Is it, is your growth hormone? You guys, are you able to test through your labs for growth hormone levels and see if people are low there?
Yeah, absolutely. Nice. Yeah, I mean, we've partnered with, two of the foremost largest labs in the world, LabCorp and Quest. So we have an abundant amount of testing options at our disposal, and we try to keep it simple for the consumer and offer 3 packages. And, all of them are extremely comprehensive, especially compared to what you would get at a primary care office. But it really just depends on your budget and the depth and where you're really trying to go. But they range from $99 to $249 to $599, and they all come with a great follow up session from one of our medical advisors, whether it's 30 minutes or up to an hour for a larger panel.
Nice. So that would be the first step, right? People would get a panel, like they would come in from you, get a panel, and then have a consultation and kind of see what the needs are from that point, right?
Yeah, we have a handful of therapies and product lines that don't require a lab, but from our perspective, we think there's so much power in the knowledge of knowing your baseline. So we advise patients, even if they don't want one, to get one at some point or another. Some of them do require that we run labs on it. So we put you as the consumer in the driver's seat, and we really just try to ensure that we're keeping you safe and achieving the goals that you came to us for.
Great.
I think it's pretty interesting because we work with a lot of influencers and people in the health and wellness space. And what I will say is, like, even people who look so healthy on the outside will oftentimes have issues on the inside that we will catch and we have caught. And there's some really great examples of that. So, there's usually always something going on with everyone that you can optimize. And it's interesting to see, vitamin levels or different little things that you could just make an easy change. You can make an easy supplementation and really improve some of those levels. So there's always something to find.
Absolutely. Yeah. I'm a huge believer in that. I think everyone should get their blood tested at least once every 6 months. Same thing. Like you mentioned, on my last test, I had all of a sudden my prolactin was very high. Maybe, I'm not sure why, maybe because I eat more of a higher fat, lower carb, higher protein, higher fat, lower carb. I'm not sure exactly why, but, based on those results, I was able to see, okay, what supplements are good for lowering prolactin? Oh, vitamin B6, vitamin E, a couple others. So I start taking those, get a blood test again 3 months later, my prolactin levels are right where they need to be, So I think even for supplementation, it's super important. Just regular supplementation, I think it'd be really important for people to know what their different levels are. And again, years ago I was taking selenium before I got a blood test. Got a blood test, my selenium levels were a little high, so obviously stopped taking selenium. So these are things that really everyone should be doing, and especially with regards to the hormone, your testosterone levels for men, and again, if you're having any sort of issues, whether it be menopausal or premenopausal, big believer in the blood tests and taking a look at that.
Yeah, great. Us too.
Great. Well, where can people learn more from you? Where can people, get their blood work done and have a consultation and kind of see if any of these things we just discussed are right for them?
Well, I mean, for the men, it's super easy, blokes.co, and that's BLOKES. And we have a lot of love, a lot of community going on our Instagram page, which is @GetBlokes. And the ladies, I'll let you tell them where to go.
The ladies on IG as well is Joy Women's Wellness, and we spelled Joy, JOI. And then our website is choosejoy.co. Almost forgot that one.
ChooseJoy, JOI.co and blokes.co, not .com.co.
You got it.
Thank you.
Yeah.
Excellent. Yeah. Well, thank you so much. And any last words or final kind of comments? I think we covered a lot we were really efficient here. This was really good.
No, I love it. Like, listen, this isn't a sales pitch from us. We We want to improve everyone in the community, and whether it's your local doctor or somebody else, and we want to empower people to own their journey in health. And if they take away anything, that's what we want them to take away.
Absolutely. Well, thank you. Thank you for sharing this information. You really kind of, I think, simplified it in a way that our listeners who aren't familiar with this stuff can really kind of get a better understanding of hormone therapy, peptide therapy, the weight loss drugs, and who that may or may not be right for. And really appreciate you sharing your knowledge with us here today.
Yeah, thank you.
Great to talk with you.
Thank you. Yeah, hope to do it again soon. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe.